Thank you, Senator Ossoff. Senator Warnock from Georgia is recognized. Welcome.
Thank you so very much, Mr. Chairman. And folks in Georgia are very much focused on public transit. And like Senator Ossoff, it's certainly a concern of mine and a high priority. Every day, thousands of Georgians rely on public transportation, from Atlanta commuters taking MARTA to work, to our veterans and our seniors who are living in rural Georgia using one of our 80 rural transit services to get to their doctor's appointments. 80 rural transit services. I think that's an important point because often when you talk about public transit, as you know, people assume urban, but the rural communities very much rely on transit services in some ways more. Safely and efficiently getting Georgians where they need to go is a priority of mine. And that is why I fought to include provisions from my Capital Investments Grant Improvement Act and increase funding for the CIG program in the bipartisan infrastructure law. The provision I wrote to lift the small starts project size cap is already enabling MARTA, Georgia's largest public transportation service, to develop and improve its transportation infrastructure to benefit millions of passengers. Administrator Fernandez, how will lifting the project size cap for small starts create jobs, allow more communities to benefit from the CIG program, and expand public transportation service?
Senator, the Small Starts program is a very important program, part of our capital investment grant. And I can say to you that there is a pipeline right now in our CIG of over 60 projects. 50% of those are small starts. So we're seeing more and more bus rapid transit projects coming to the fold. And the pipeline itself is, as I noted earlier, 150% greater than anything we've ever had vying for funds. By lifting that cap, what it would do is give transit agencies the opportunity to better bring their resources, their local resources, and be able to maybe even accelerate some of the projects that they have in their portfolio. And if it's a single project that they're pursuing in a community, or maybe their first ever Small Starts project, it gives them the opportunity to introduce that project sooner and to be able to bring that high quality service to the community and the corridors that it will serve.
Yeah. As I often say, if people can't get to where they're going, they can't get to where they're going. Or said more positively, we need to help people to get to where they need to go through being able to move physically. So I look forward to working with the FTA to ensure that the bipartisan infrastructure law continues to expand access to public transportation in Georgia, in rural and in our urban communities. During the height of the pandemic, rural transit systems played a critical role in preserving public health and filling the gaps, whether it was meal delivery or rides to vaccination sites. So I'm not surprised that when I travel across Georgia, I was down in Valdosta a couple weeks ago, Waycross before that, Columbus, I hear and see demand for small urban and rural transit services to connect Georgians to healthcare services, to education, jobs, grocery stores, and so much more. Last year, I introduced the HOPE Act to help rural and disadvantaged communities identify and address their transportation needs. I'm glad that this year's government funding bill provided $20 million for the HOPE Act, now known as the Areas of Persistent Poverty Program, which will unlock funding for rural transit projects in communities like Chatham County, Savannah, Georgia, Valdosta, and will improve access to jobs. Administrator Fernandez, what has FTA learned in its early implementation of the Areas of Persistent Poverty program as it works to make public transportation services more accessible?
Senator, it's a very important program, and what we're learning is that there are communities where the access to a minivan that can get an individual who recently had surgery and needs to go for physical therapy and can no longer drive or cannot drive throughout that period, it is their connection to health improvement. It is their ability to recover. I was recently in Jackson, Mississippi, and had the opportunity to talk to a woman who had experienced just that, where she thought that public transportation was for other people, and she realized that that other person was her. And recognizing that she lived on a street that did not have a name or an address, but the paratransit vehicle was still able to reach to her location and get her to where she needed to go. So we recognize and have always been very cognizant of the significance of having good public transportation in rural areas. And that's one of the reasons that through our Coordinating Council on Access and Mobility, bringing together all of the resources in government that are available to whether it's human services and some of the other cabinet departments and agencies to encourage leveraging those dollars so that service transportation, non-emergency transportation is available to individuals no matter where they live.
I'm out of time, but you talk about the importance of this in the ordinary, everyday lives of Georgians. Congress, as you know, funded the Areas of Persistent Poverty Program in appropriations this year, but has not permanently authorized a program for future years. From where you sit, can you talk about the importance of ongoing funding of these programs for rural and low-income communities?
Yeah, these programs are very important. We know that these areas are designated when there's 20% of poverty in the county, and that's how it's designated, and recognize that many of these locations are distant from urban centers, they're distant from trauma centers and other critical needs and access points. So clearly having human service transportation together with rural operators working collaboratively to ensure that there's always access to individuals, whether it's for routine or whether it's for medical services, that public transportation can be there when it's needed.
Thank you, Senator Warnock. I would only add that both Senator Ossoff